webinar we have started since the COVID in Pakistan. And this was only to create the awareness to the common man, to the students, and to our consultants, and to the doctors. Pakistan Medical Association, with collaboration of PAC, Pakistan Association of Pathologists, and with collaboration of Women Medical College, Ahmedabad, and with the collaboration of Azad Jammu Kashmir Medical College, Muzaffarabad. And every week we invite the legend people related to the different specialties, different fields, who have some visions about the COVID. And so Dr. Palitha Mahipala introduction, the whole the Pakistan knows about him. And Palitha Mahipala has facilitated, we are very thankful to you, facilitated the vaccine to Pakistan, sir. And due to your cooperation, now the government of Pakistan is able to give, I think, more than 69% of the people's complete dose. So before this, you start the today's presentation, I will request Professor Qazi, Dr. Qazi Saab, he is the elect president, to give, if just brief, today's situation of the vaccine in the Pakistan.
Thank you, Professor Mulazim, and thank you, Dr. Palitha, for joining us at this forum of Pakistan Medical Association on this 29th PMA webinar. The current situation as it stands today is right before you on the screen. The vaccine stats is we have partially vaccinated 124 million of population. The fully vaccinated is 96 million, while we were able to have 4 million booster doses. So total doses of 209 million people. And in the last 24 hours, 922,000 people were vaccinated. And the confirmed cases in the last 24 hours is 847. And the critical care cases in the last 24 hours were 0. While the deaths, throughout this COVID, we had the total deaths of 30,173, while in the last 24 hours, we had 20 deaths. And the recovered cases, they're doing fine. And I think our positivity rate today stands less than 3%, which is 22.7% overall.
Less than 3%.
So with this situation, please carry on. We would like to hear Dr. Palitha.
Thank you,
Dr.
Qazi. Thank you, Dr. Qazi. Before I request Dr. Mahipala to start presentation, our next panelist is also Major General American. I'm very thankful to sir. You gave, I know you both peoples are very busy and remained busy during this vaccination program. Now, Dr. Mahipala, Palitha Mahipala, it is over to you, sir. Thank you, sir.
Thank you so much. It's a great honor for me to join you today for this webinar. Thank you for inviting me to join you. Let me give a brief presentation on the global, regional, and then country situation. Can we share our screen? I will present some data which is by 25th of February, and also some data which I get globally today. Now, if you look at the global situation, by 25th of February, 430 million cases reported across the globe, with 5.9 million deaths. And if you look at global average per 1 million population, it's something around 60,000 cases. And deaths are 731. And if you start to compare that with the Pakistan figure, Pakistan, if you look at number of cases per 1 million population, it comes to just above 6,000 cases. Again, if you look at the deaths globally, it's 731 deaths per 1 million population, where it's close to 200 in Pakistan. So these are just a comparison, not individual countries, but with the global average. And by now, it's 10.4 billion doses given across the globe. But majority, 70 to 75% of these vaccine doses in few countries, 10 to 15 countries. So there's huge vaccine inequity. And among the 194 member states globally, I think close to 63 member states who have not reached 40% of full immunization. So that shows the inequity. And if you look at again the global average, for 1 million or one person, if you look at, it is 1.29 doses is the global average, and Pakistan it's 0.94. Now there are WHO 6 regions. Europe region is reporting the highest number now. Earlier it was for 3 waves, it was the Americas, but now it's Europe because you know Europe has been hit very hard due to Omicron. So then Americas 146 million, Southeast Asia 55 million, Western Pacific 22 million, and Euro region where we belongs to 21 million cases have been reported. And you can see first, second, third wave globally, and comparing with the fourth wave is five times high number of cases reported during the 5th wave. So it's mainly due to Omicron, and globally now more than 95% of the cases reported are due to Omicron. This is a global picture. Now, fortunately, last 2-3 weeks, number of cases reporting start to come down globally. And almost all the regions, it's coming down except the Western Pacific region. And region we belongs to, Eastern Mediterranean region, it start to come down dramatically now. This just show the genomic sequencing capacity in different countries. You can see out of 22 countries in our region, 15 countries have the capacity of reporting, and Pakistan is one. And it was said Pakistan is the best among all the other Euro countries when it comes to reporting on genomic sequencing. So that much of capacity we have. And I don't want to go into all these details. Let me see the final summary about the Euro countries. Now we see dramatic decrease in reported cases. Reported death trends also started to decline now. More than 50% of weekly cases are from Iran and Jordan, and other countries it is now mainly coming down. Now, if you look at the global situation, you know, Omicron BA2 variant is a little bit more risky compared to the other, but it's not much reported in many countries. Mainly less severe cases are being reported when it comes to Omicron. So this is the comparison of the vaccination across the Euro countries. We have 22 countries. We can see Pakistan now, when it comes to fully vaccination, it crossed 40%. Now it is 43%. And partially vaccination. This is for total population, not the targeted population. And you can see there are some countries reach much more, but there are many countries below. We are in the middle in the region. Highest number of cases per 1,000 population, if you compare again in the region, Pakistan is very much low. So you can't go and compare the total population total cases reported, but you really need to go by either for 1 million population or 1,000 population number of cases and deaths. So if you do that, Pakistan is one of the lowest number of cases and deaths reported in the Euro region as well as globally. Just to highlight the measures imposed, you can compare with other countries. Pakistan is one of the countries has imposed many measures throughout, but now being much relaxed because cases are coming down. Again, how long it took to lift the measures? especially the gatherings, Pakistan has kept it for a long time. Again, if you compare schools, how Pakistan is working on that, I think school, again, the measures have been kept for a long time. Those were the reasons why Pakistan was able to come out with this pandemic situation very comprehensively and remarkable way. Now, this just now it has been presented. So if you go by total number of vaccination done is 210 million, 209.4 million. If you look at the target population, fully vaccination comes around 60% now. Partially vaccination come close to 80% among the target population. But the global indicator is from the total population, because Pakistan has a huge under 12 population. And if you look at the total immunization or total vaccination comes down to 43% now. But it's an amazing vaccine drive in Pakistan. Last few weeks, it's 2 million vaccination doses were administered every day. So that's the vaccine drive in Pakistan. So I would say it's really super fast. Now, if you look at the total number of cases, is coming down. Pakistan is observing the fifth wave, though globally it is fourth wave, and fifth wave is suddenly went up to 8,500 within 2 to 3 weeks. That was the highest number reported since ever the pandemic was started, and now has come down. Now it is less than 1,500 cases a day. So that's very much low, and deaths also is very low. Now, this is how by Friday cases were reported. Is still seen this reporting high number. Punjab and KP are two other districts reporting high number of cases. So number of deaths again, Sindh and Punjab and KP reporting the mostly number of deaths. So altogether 30,139 deaths, which gives a case fatality 2.01. Now, this is an important slide. If you look at all waves, 5 waves and number of deaths reported. Now, fifth wave, you can see sudden rise of cases. The highest number of cases per day reported in the fifth wave went up to 8,500 compared to first wave, where the highest number was reported 6,600 cases. And since then, it was coming down, but fifth wave, it was very high number of cases. But looking at the deaths, you can see there's a distinct difference in fifth wave. This is one of the proxy, I think, evidence we have that vaccines are working very well, and Pakistan vaccination program also working very well. As recommended by WHO, focusing on initially high-risk groups, like above 65, above 60, and then focusing on comorbid patients. And this vaccine deployment plan in Pakistan has worked very well. And then healthcare workers and other more vulnerable groups have been covered quickly. So we can see deaths have really come down. This is one of the good indicator we see. And we have started the vaccine effectiveness study among healthcare workers. And we have some data available which shows vaccines are very much effective in Pakistan. Number of lab tests done, there are some areas where some provinces, number of tests done is not enough, but overall, if you look at it, it is quite reasonable. One of the reasons why, if you compare case fatalities to, one of the reasons is number of tests done is comparatively low compared with some countries. So denominator is less. If you do more testing, probably we will find more mild cases. So your number of cases will be high, and deaths are then compared to will come down. So this is one of the reasons. But I would say it's amazing work done in capacity building. Initially, Pakistan didn't have any testing facility, but NIH under Dr. Ikram's leadership, within 2 weeks started the facility. Expand to 106 labs across the country in 3 months. That's an amazing capacity building, and at the moment 156 labs are functioning across the country, but more than 200 labs have capacity to do testing, and I think testing capacity is something around 100,000 a day. And during the peak in fifth wave, number of tests done have gone up to 65,000. And already 26 million tests have been performed. And when it comes to genomic sequencing, Pakistan is doing extremely well. Rapid antigen testing is another addition. I don't want to go into all details. Now you see test positivity has come down. That test positivity is a proxy indicator of level of transmission, so that shows level of transmission is also low. It's not average, but across the provinces, you can see it's all below 5. We start to monitor by district. WHO have district surveillance officers in all high burden districts. You see still Gilgit, Hyderabad, Muzaffarabad, there are few cities, it's more than 5%, but other than that, all the other places, it has come down below 5%. So that shows level of transmission is low. Now, number of cases admitted is 1,249 and number on ventilator 144. You are aware that number of beds available with oxygen facilities more than 6,000 in the country. Number of ventilators 1,500 available. So health system has been very much strengthened after the first wave or during the first wave. Since then, there was no compromisation of the health services and easily accommodate much more patients. So patient care has not been compromised after the first wave. Healthcare workers' infections are very much less now. That's again another indicator of effectiveness of vaccines and good vaccination program among healthcare workers. These are the genomic sequencing data. Now Omicron is basically replaced all the other variants, and globally it's 95% or more is Omicron. Pakistan also, all the provinces, Omicron is present. You can see all the provinces. And number of sequencing done is 15,440. That's an amazing figure. They're really good, and NIH is leading this, and WHO is so happy to support. We supported to establish 32 labs with PCR machines, and then genomic sequencing, we established Doe University, a new testing facility, and we supported NIH with reagents and capacity building, but NIH is doing a great job there. I don't want to go into all these details, but if you compare the countries who are supported by Gavi, Pakistan is the best country doing vaccination. But high-income countries, they have so much of vaccines available and coverage is high. But I must say, total doses so far received is 286 million doses, out of which more than 90% is being used in Pakistan. And the most important thing is that Pakistan started bilateral negotiation even before COVAX supply to get vaccines. So that's a really good feature. So, and Pakistan is focused on elderly population, adults, and so on. So gone by the good vaccine deployment plan and good policy. And if you look at these, some of the countries, when the vaccines coverage is high, even you have high number of cases, deaths are very much less. Is one of such evidence available in Saudi Arabia. And probably our study, we have completed 4 weeks, another 4 weeks to be completed, which we have undertaken to see the vaccine effectiveness study. We can present the data review. Pakistan, as I said, it's more than 40%, 43% now fully vaccinated. Now we need to focus on booster doses because elderly population and then comorbid population are high risk. So we need to now look at the booster dose. So far 4 million given, but we need to really look at that to reduce deaths further. So safety and effectiveness, WHO approved vaccines, what is being used in Pakistan is all are good and effective. And there are so much of studies have been performed across the globe. High vaccination coverage among priority groups prevent deaths. I think that's the most important thing. So booster dose, we really need to focus on this. That's all. I have so many other things to present, but I don't want to go into all details. But let me say, Pakistan, if you look at the the number of deaths compared to many other countries, if you look at for 1 million population, number of deaths are very much less. And then fifth wave, fourth wave, we have started to see number of deaths are much lower than first 2-3 waves, which shows the effectiveness of vaccination program in Pakistan. And then, of course, clinical management and care is also very much improved. Health system strengthening was done. And we again undertaken a study after the first wave in with Khyber University in KP to see the factors affecting high number of deaths in KP. And we have seen the delay in admission as one, and then the severity of the infection. And when somebody is referred to ICU and ICU care, it's not easy to, outcome is not that good. So we need to really look at high vaccination coverage to reduce deaths. At the same time, it's good to look at, as I have shown in public health measures, mask wearing, social distancing, hand hygiene. These things prevent you and the infections so that deaths will be reduced. So that's all I wanted to present to you. I'll stop here, but if there are any questions, I can answer. Thank you so much. Over to you.
Thank you very much, Dr. Palitha. A very complete picture of the Omicron and current situation of the this COVID pandemic, not only in Pakistan and also in world. Before we start question answer session, I will request Major General Amir Ikram. Thank you very much, sir. Can you give your viewpoints about this? And the very important thing is that you will explain about the policy that you adopted during this COVID from the last 2 years. We will have, inshallah, one complete session with you, sir, on the quality control of this PCR about the COVID. Major General Amir Ikram, Director General, NIH, over to you, sir.
Assalamu alaikum and a very good morning to all of you.
Thank you so much,
Thank
sir.
you so much.
Thank you so much, sir.
Thank you so much, Professor Mulazim. You're doing a great job, and that we understand this is the time when the experience should be shared, and that truly makes the difference. We understand Corona has been a big challenge, but my concept is that such challenges do bring in opportunities. And it is our duty to convert those challenges into opportunities and then opportunities into realities. And that's what has practically happened. We stood as a nation, and that's the big reason. But the foremost thing is definitely the role of the partners and the donors. And I think the very close association with WHO and in particular the country office and even the individuals make a lot of difference. So Dr. Palitha has been a great help during this crisis period. So on behalf of all of us, we would like to thank Dr. Palitha for all the support that he has extended throughout the country. And I being very close to him, very close to the WHO country office, we have been closely watching. So I think joining hands together makes a true difference. And that is what is required in all the fields. So thank you, Dr. Palitha. And the way he has elaborated the things, practicalities, there have been so many concerns from different angles, from different people, from different institutes. What are the statistics? Are we doing the right way? Are our statistics right? No, they have been extremely right, because once in the very initial days, all the meetings and other events used to be held at NIH. I think the breakthrough point, the biggest achievement during this period that could be achieved was the establishment of National Command and Operation Center. That basically provided the platform, an overarching body, bringing in the provincial government, along definitely the federal government component being there, bringing in all the partners and donors, public and private sector together, and a uniform policy. I was just last week attending a WHO meeting on accelerating the things. And the outcome was mainly having a uniform platform and a uniform policy. And that is what mattered. I would just like to narrate one of the recent examples. I mean, getting this Premier League, Pakistan Premier League done during crisis. I mean, Omicron is very much there. But alhamdulillah, it's been a great success. Not even a single player that could catch or not even the audience, and even the cities of Karachi and Lahore. Karachi was otherwise slightly higher on the percentage. So we never got any rise in the number of cases. So this means that I think strict vigilance implementation, because I think implementation has been the area where there has been more focus. It's much easier to make the policy sitting in the rooms as a national body, but actual implementation and practicalities on ground have been immense. Just to give you an example, we started off with 300 tests for PCR at NIH in a day, and we just had 1,000 in the stock. Today, alhamdulillah, more than 200 labs all across the country are performing. And the major brunt has been taken by the public health labs that were established by NIH in all the provincial and regional capitals. They have performed tremendously. At the end of the day, again, the things are there, but all appreciation to the team that they could make it. And next time you'll be talking about the quality, how we try to maintain that. There have been issues definitely in certain labs, but overall, I think it's been immaculate. We never allowed the antigen testing till very recent days because we wanted to mainly bank upon the PCR. Similarly, we established a Center of Genomics, as already pointed out by Dr. Palitha, and it has again come up to the expectation, not only at the national level, but international level. And this Center for Genomics would be covering currently COVID and viruses, but moving on to microbiological. And later on, we will be having the human component for genomics as well. So this is how we have evolved during this crisis. And one of the main example, I think, is vaccine, where we've got a very robust system of picking up the person, directly connected to the NADRA, and getting the precise data. And not only that, we started first ever phase 3 clinical trial, as you all understand, for CanSino in Pakistan. We just wanted to make the trial successful. The outcome of vaccine, whatever it could have been. But alhamdulillah, we conducted the trial in 7 different centers. The trial was a great success. And based upon that, now we have got a great inflow of phase 3 clinical trials in the country. And this is the area where the clinical side, medical side needs to put in a lot of efforts so as to join hands. And that was tagged with transfer of technology. So we started co-manufacturing CanSino within NIH. Alhamdulillah, we have achieved the first target that was given of 20 billion. So this is what we can do if there is a will, there is way, there is dedication, there is always, I think, joining hands together, and we stood as a nation. So all in all, extremely grateful to all the colleagues that are here, because you have been performing in your own field. It's been very tiresome, difficult time, but I think you all stood steadfast, and we need to stand together. And once again, all thanks to Palitha and Dr. Mulazim. Thank you so much.
Thank you, Major General Ikram. I know in the beginning of this COVID, your personality worked like an active molecule for the Pakistan, and you provided so many opportunities. We will have another. I have requested you. There are so many questions on the PCR and something else. Now, I start the question. First question from my side, Dr. Palitha. One of the question from our President Salman Kundi. Question was, what is the statistics of COVID in Pakistan, and what is the statistics of vaccination in children in Pakistan under 10 years?
Oh, okay. Thank you so much. Let me, one point I forgot to really appreciate the initiative of again Dr. Major General Ikram, this vaccine production. And PakVac so far produced 20 million doses. That's amazing. One of the countries in the region, started to produce vaccines. So early stages, but still 20 million doses have been produced. And now there's a lot of discussion going on. WHO has announced 13 countries in the world where WHO would like to support to produce vaccines, and Pakistan is among that. And there are 2 countries selected from this region, Pakistan and Egypt. And we have had discussion now to see how best we can transfer the technology. So I think again, NIH is playing a great and impressive role there. Now, coming to the status of COVID-19, now we see we are in the fifth wave, and cases are coming down rapidly, extremely rapidly. And the global experience for Omicron is that it goes up quickly and also come down quickly. And again, there's a comparison done globally. Europe took 4 to 6 weeks to reach the peak, but in Eastern Mediterranean region, it's 2 to 3 weeks to reach the peak. And also when it reached quickly, it's come down quickly as well. So we expect that this coming down very, very quickly. And one of the reasons is also the good coverage of vaccination. So if you look at the partial vaccination, it's close to 80% of the population. And also there have been seroprevalence studies done in Pakistan. More than 40,000, 43,000 samples were tested for antibodies, and 42.4% seroprevalence in Pakistan. So having close to 80% partial vaccination, 42.4% seroprevalence, and 43% fully vaccinated among the total population. So that shows the level here. So I'm pretty sure that this is coming down. That does not mean that there cannot be another wave. But of course, why we are looking at this, how we are looking at this is globally now, pandemic to endemic. So you won't be able to, totally eradicate this virus. That will be there. But if the deaths are very much low, it will be another endemic situation. So that's where the global thinking is now. And Pakistan is a good example where a number of cases rapidly came down and complications are much, much low. And number of deaths are very much low. And if you look at the graph I have shown to you, comparing all 5 waves, fifth wave, we have seen a distinct difference when it comes to cases and deaths. So in Pakistan, fifth wave is strongly and robustly coming down. Deaths are very much low. And now vaccination under 10 years. So at the moment, government policy decision is about 12 years. I'm sure now there will be a consideration below 12 years to vaccinate up to 5 years. But I think focus should be, if you are really focused on deaths, and if you analyze the deaths among the different strata of the population, it's mainly happen among comorbid people and elderly. So booster dose, if you really focus on that and cover very well, number of deaths will much come down. So that's how I look at this. Thank you so much.
Dr. Palitha, on one side, we are saying that this Omicron is not producing a hazard. On other side, we are also looking that patients are coming in hospitals. I give my example of this. The role of booster dose. I taken the booster dose myself. My son taken the booster dose. My wife taken the booster dose. But my daughter was on exam and she could not take the booster dose. And from the last, she is suffering with Omicron. Thanks God that she is well. What can we think about the patients who are dying? I will also request this from Dr. Bilkis. Dr. Bilkis is the head of the Department of Medicine, and she was the focal person of COVID from the last 1 year. Dr. Bilkis, Professor Bilkis from King Edward Medical University, Mayo Hospital, if you are there, can you explain why the people are still dying? Is there something else along with this Omicron, or it is the Omicron who is putting them onto the death?
So thank you for including me in this wonderful discussion, and we are very grateful to Dr. Palitha for throwing light on something very important as far as statistics of COVID Omicron are concerned. I'll share with you my experience. I'm working as chairperson, Department of Medicine, and in charge of COVID services and in charge of telemedicine services at King Edward Medical University. Now, King Edward Medical University is affiliated out of the 7 hospitals One of them is Mayo Hospital, which is the biggest center which has been arranged by the government of Punjab and Pakistan to serve for the COVID patients. So as far as experience of Omicron is concerned, we had more than 100 patients at a time. So it was 118 to be exact during the last 4 weeks. And the patients we nowadays admit are those patients who require oxygen monitor, which are severe in their clinical picture, requiring oxygen support, requiring close monitoring, HTU and ICU patients. The statistics, as far as we collected, and we did collect data for research and publication during this wave. The data which we have collected, I'll give you an approximate, about 95% of the patients whom we were admitting in the ICUs and the HTUs were either absolutely unvaccinated or partially vaccinated.
Oh, great difference. Oh, great difference.
This was something very significant. Then another thing we observed was that majority of the patients who expired or developed long morbidity and long disease of severe and eventually did not recover were the ones who were unvaccinated or partially vaccinated. During the last 1 week, we have been receiving patients who have been vaccinated but not received their booster dose. So what we observed was either the absence of a booster dose or other comorbidities. And the most remarkable observation was old age and presence of an underlying previous post-halt syndrome, previous exposure to COVID. And one very interesting observation, Professor Mulazim, was that we found that there seems to be some genetic tendency, and I would like Dr. Palitha to share his observation regarding this, because there are families which tend to go into severe disease, and then there are families in which even the unboosted or the elderly don't develop either severe disease or recover completely.
Very important.
So is there any genetic tendency? So this is something we observed, that there would be families who would be, on the ICU beds, and some of them unfortunately not recovering. So this was the general observation and the experience we came across. And yes, we are observing a downfall trend, and hopefully this is the end of the pandemic in form of Omicron and less severe viruses.
Dr.
Thank
Palitha,
you,
there is
Professor
another
Mulazim.
question to you. Can you think that now we are ending the pandemic?
Well, that's definitely a very interesting wish. Definitely, it's a great wish. We would still. The first wave that we got was D614G, the wild variant, and we thought that the story might be over after that. But one after the other, the 4 different strains, and now Omicron, and Omicron sublineage, now BA2 spreading. But it is very curtailed. The good thing is, Omicron seems to be, as already pointed out, I think Professor Bilkis, that Omicron may act as a natural vaccine. And because it has a very fast tendency to spread, and number 2, the severity of the disease is less. If you compare the 2 lineages, BA1 and BA2 is slightly severe, but still we have yet not come across. As far as different features are concerned, I myself, I had a grant, and I'm working with the University of California, and we are getting some very amazing results. Some of them even coming down to the dietary patterns in Pakistan are helping. It's the genetic propensity may be there, but coming down to different things. And one of the things that comes is the desi ghee even. That makes the cases which are taking are less prone to getting the severe disease as compared to those taking the oils, and because it is the molecules that are degraded. We are coming to certain conclusion on that, on linoleates and all that. Let's see what the final outcome is. But I think it's the immunity and so many other things. And this study has been really amazing. And we have got the first patent now, which is being registered for the study in US. And let's see, once we are near publishing, and we'll get back to you with so many factors that can play the role in different regions of the world. Thank you.
Same question, one question, Dr. Kausar, from you. She is asking, should pregnant women who have had 2 doses of the vaccine can get the booster? And if yes, then which vaccine and which trimester? Same question. Can you explain, Dr. Midjana Amir?
Right. See, I mean, right now, recent studies have been concluded. The things have gone in a very phase-wise manner. Earlier was 18 and plus, and then at that time, considering the propensity of the virus for ACE2 inhibitor receptors, initially 18 and plus were given. And then from 12 onward, 12 to 18, the studies were conducted. Then moving on to the next phase, the 5 onwards. Now Pakistan, we are giving Pfizer for 12 onwards, and we are working for modalities for the Chinese vaccine because there are so many parents which are concerned. Now, all these vaccines are undergoing trial in pregnant ladies. One of the studies that is coming up, the results would be published very soon, which says that it can be safely given during pregnancy. There are already a few. And in certain countries, they've already started off. In any case, you're truly right. Considering the booster, and none of the studies is conducted the booster study till yet. And the safety has been established during the trimesters. So we need to wait a little bit till the time if a lady gets earlier and 6 months have passed and you'd like to go for the booster. My word of caution, the world still needs to wait and watch for so many things as far as regards to vaccine. Please.
Can I just share one slide?
Yes, yes, Dr. Palitha. Yes, I was, yes, Dr. Palitha, yes.
Now, this is just to take up the point what is being highlighted by our professor from King Edward Medical College. This set of data we collected, number of cases and deaths. So this very clearly highlighted among the people who have been vaccinated, number of deaths are extremely low. Even partially vaccinated, number of deaths are very much low. And most of the deaths are among unvaccinated people. So I would like to, this set of data we collected from different parts of the country. So it is quite, important probably data we have, that if you are vaccinated, chances of dying is even partial vaccination is very much low. So just I wanted to highlight this point. And just one point about the pregnancy and vaccination so far. I think the evidence is quite there where you use Pfizer vaccine for the pregnancy, especially booster dose, but more data will be available as Professor Amir said. Then another one point on Omicron is Omicron does usually affect upper respiratory tract. So pneumonia and requirement of oxygen is quite low. So that's why though we expected so much of patients coming to the hospital, the numbers were not that much comparatively because it's mild form and oxygen is not that much required compared to Delta variant. So that's all. Thank you so much.
Thank you so much, sir. The question, one question was with you, Dr. Palitha. What you are looking about the pandemic?
I couldn't get it. What is your question exactly?
The pandemic is now, this is the over, or it will still continue with any new coming, any BA2 or something other variant of concern?
Wonderful. I think this is $10 million question. If somebody has an answer, he will get millions of dollars.
Because Ikram has explained.
It's very unpredictable. You can't, but it's pretty sure now. It's most of the countries starting relaxation. So few points you need to highlight. You can't eradicate these viruses. It will be there. But it's now we see is transforming from pandemic to endemic. Vaccine coverage has to be high. That's number one. And then the public health measures. So we have to be cautious in relaxation. We really need to have surveillance system in place. So we need to focus on disease surveillance. We need to focus on SARI and ILI surveillance. We need to identify the number of cases going up. So vaccination is one area. We need to really reach high percentage of coverage, and then public health measures. So it's a matter of, how you respond. But basically, we think that by the end of this year, probably pandemic as it is will be most probably over or will be very much less. But it will be an endemic situation, but countries have to be cautious about the preventive measures. Over.
Thank you very much. If there is no question, I will request Professor Sarma Kundi. Dr. Qazi Sahab, can you give the vote of thanks to everyone?
Okay, thank you very much, Professor Mulazim. We are really thankful to Dr. Palitha and Major General Amir Ikram for their excellent, coverage of this very important topic. Thank you, Dr. Palitha, for not only updating us the situation
Dr.
in Pakistan.
Prime Minister Azad Jammu Kashmir Special Consultant of the Health, Dr. Asma Andrabi is with us. Thank you, Dr. Asma Andrabi. I hope you will convey this our webinars output to the Prime Minister of Azad Jammu Kashmir, who was with you during the celebration of the this mosque. Continue, sir.
Okay. Thank you very much, Dr. Palitha, for updating us not only the situation in Pakistan, but the region throughout surrounding us. And we are really thankful to Professor Major General Amir Ikram for
his efforts. Sir, we have requested him to give about something about the PCR next time, sir.
Okay, yes, we'll definitely love to have him as the speaker as a full-time, presentation by him. And we are really thankful to him. And thank you, Dr. Bilqis, Professor Bilqis, for sharing her experience at the King Edward Medical College. And thank you all the participants who were there for this very important topic that has been discussed today. And on behalf of Professor Salma Kundi, President, PMS Center, I, Dr. Qazi Wasif, would like to thank everybody. Dr. Qasir Sajjad, who is the Secretary General of Pakistan Medical Association. So in the end, thank you, everybody.
Dr. Palitha, my students from Azad Kashmir are watching things on the TV, and they are very thankful to you are coming, especially in the Muzaffarabad. And your support, not only the Muzaffarabad and all over the Pakistan, as the Major General Ikram has also thanked to you. And Pakistan is always very thankful with the help of NCOC and with the help of wisdom of our government and with the help of our institutions that we shake hand to hand. And Pakistan was able to not only control the transmission, also, alhamdulillah, Pakistan was able to control the severity, and the Pakistan was also able to handle these situations. Alhamdulillah, we know that Pakistani is the nation when they stand up with any cause or they unite to any cause. Always Allah is behind this nation. And at the end, I will say, Pakistan Zindabad, Pakistan Paindabad. Thank you so much, Medana. We will see you next week, inshallah. Thank you so much, sir. Thank you so much. And this is the mask you introduced. This was the biggest celebration in Azad Jammu Kashmir. You personally came, and the Prime Minister of Azad Jammu Kashmir also participated in this one. Thank you very much, everyone.